13 foods that can lower your blood pressure naturally. Your blood pressure might cause serious problems like heart disease or a stroke if it is too high. The lifestyle is very important in the treatment of high blood pressure. Maintaining blood pressure control through a healthy lifestyle may eliminate, postpone, or minimize the need for medication. Here are 13 foods and lifestyle changes that can lower blood pressure and keep it down. 1. Leafy green. Your body retains more fluid when you consume salt. Your blood volume and artery pressure increase, as a result, raising your blood pressure. For a potassium boost, pile leafy greens like collards, spinach, broccoli, or kale onto your plate. The mineral relaxes the walls of your blood vessels and aids in the removal of sodium from the body through urination. 2. Berry. Anthocyanin, the pigment that gives blueberries, strawberries, and blackberries their vibrant colors, has a positive effect on your blood vessels. It's a natural substance that can widen and make arterial walls more flexible, lowering blood pressure and enhancing heart health. 3. Yogurt. Calcium plays a crucial role in maintaining healthy blood pressure because it helps your blood vessels contract and relaxes at the appropriate times. You can get enough calcium in your diet without adding a lot of extra sugar or fat by eating plain, low-fat yogurt. 4. Fatty fish. Fish in its bones, such as canned salmon or sardines, is another excellent source of calcium. Oily fish, such as mackerel and sardines, are also rich in omega-3 fatty acids, which improve health and support the heart. 5. Seeds. To help lower your blood pressure, add unsalted seeds like pumpkin, flax, and sunflower to salads, yogurt, or porridge. Vital elements like magnesium, which helps regulate blood pressure and relax your blood vessels, are present in seeds. 6. Oatmeal. This whole grain is nutritious, satisfying, and sodium-free. It also contains a lot of fiber, which aids in controlling your blood pressure and weight. 7. Beet. According to a study, consuming 2 cups of a juice mixture made up of 3 parts beetroot and 1 part apple juice will lower your systolic blood pressure within a few hours. Your risk of stroke can increase if your systolic pressure is high. A good alternative is cooked beets and beet greens, which are high in potassium. 8. Garlic. More than just flavor, garlic may enhance your meals. It might also help you produce more nitric oxide, which expands blood vessels. Your heart has to work less to pump blood through your blood arteries the more relaxed they are. That aids in lowering blood pressure. 9. Pistachios. Hold the salt. Tree nuts like walnuts and almonds can be a fantastic source of heart-healthy fats. But pistachios are your best option if you have high blood pressure. Their ability to drop both your top and bottom blood pressure levels appears to be the strongest. 10. Pomegranates. Pomegranate juice on a regular basis could lower your blood pressure readings. 11. Olive oil. Olive oil has an advantage over other oils thanks to its polyphenols, which are beneficial antioxidants. The health and elasticity of blood vessels are both enhanced by polyphenols. It's a wise decision for good fat. In your cooking, substitute it with butter, vegetable oil, or canola oil. 12. Legumes and beans. A daily cup of peas, lentils, garbanzo beans, or beans helps maintain and even lower blood pressure. In addition to being high in fiber, legumes and beans can also help prevent coronary heart disease. 13. Dark chocolate. It turns out that dark chocolate, which contains at least 50% to 70% cocoa, can help your body produce more flavonol, a plant chemical. This antioxidant, like garlic, can increase nitric oxide levels and expand blood arteries. Your blood pressure may decrease as a result. If you have high blood pressure or borderline high blood pressure, a healthy diet and savvy food picks can help you manage your condition or prevent it. But what you do off the plate matters, too. So lose any extra weight, exercise, and take any medication your doctor prescribes.